over to you, Dr. Ravichandra sir.
Yes.
We are live now.
Thank you. Good evening, all. So it gives me an immense pleasure to welcome you all for the third day of Health and Wellness 2021. So proudly presented by Lions Club of Mysore West and sponsored by our donors, Excelsoft and Triton Triveni, and all the sponsors who have supported our event all through. And third day has been successful, and today morning we had around 250 plus checkups on diabetes and hypertension at Mass Furniture for the employees of Mass Furnitures as a part of Lions Club of Mysore West's Health and Wellness 2021. So it gives me a great opportunity to be presenting you and introducing you a very great ardent personality, Dr. Manjunath Shetty, professor and head Department of Nephrology in JSS Medical College. He finished his MBBS, MD, and DNB from Apollo Hospitals, Chennai, and he is currently fellow of American Society of Nephrology, fellow of Royal College of Physicians, Glasgow, and he's a gold medalist in microbiology and OBG during his studies. And he has presented outstanding papers, some of which are Prevention and Therapy of Acute Kidney Injury in Developing World, which was published in Kidney International Reports, and Renal Disease in Human Immunodeficiency Virus Infection, which was published in Journal of Nephropathology, right? So he has done quite an extensive contribution to the field of medicine, and especially in the field of kidney health. And Lions Club of Mysore West has been running a permanent project, Kidney Endowment Fund, since more than a decade, and has helped lot of poor kidney and renal failure patients, and is instrumental in giving free dialysis sessions of more than 2,000 in number per year. That amounts to around 20,000 plus free dialysis sessions to all the poor renal kidney failure patients. And wellness project or wellness event being one of the important contributors to the fund which supports these dialysis sessions. So I warmly welcome Dr. Manjunath Shetty and would invite him to present his presentation, his webinar on kidney health. Over to you, sir.
Yeah. Good evening, everybody. Am I live?
Yes.
Yeah.
Yes, sir. Please.
Yeah. Good evening, everybody. It's my pleasure to talk on kidney and health. Before I start my talk, again, I would like to reiterate what Dr. Ravichandran told, that this Kidney Endowment Fund has been helping a lot of people, and we have saved a lot of lives, because of which many patients have benefited. As of now, we are giving subsidized dialysis for almost 20 patients, and that has really saved a lot of lives, especially people who are in need of financial help. So I'd like to start my talk now. So today I'll be talking to you about kidneys and your health. So that is why I've kept the caption as your health, because your health is very important, and kidneys are very important to maintain a healthy life. Right. So today, first I'll touch upon what the kidneys do, so that you know why they are important and what is their importance to your health, and what happens when a kidney fails, and who are at risk of developing kidney failure, and how do you end up protecting your kidney so that you don't end up having any kidney disease. So I'd like to put up this slide first, not to scare you, but to give you facts on how severe the kidney disease is becoming. So 1 in 5 adults all over the world, including India, are at risk of developing kidney disease. So if you have 10 friends, 2 of them are at risk of developing kidney disease. And about 5 to 10% of the adult population all over the world have some sort of kidney disease. And the sad part, or the irony you can call it, is that 90% of them don't know that they have a kidney disease because it's not been tested and not many symptoms are there for the kidney disease. And the only thing you can do to save them is early detection of kidney disease and treatment, which can slow down or stop the kidney disease. And kidney disease has become so rampant that it is causing so many deaths. It has become the 10th leading cause of death in the world. So that is the amount of, or the burden of kidney disease that is there on the adult population in this world. And even though it is scary, we have to take care of our kidneys and see that we don't end up in 1 among the 5 or 1 among the 10 or 20 adults. So what are kidneys? Kidneys are two bean-shaped organs which are located on either side of your spinal cord, just below your rib cage, and they're as small as a fist of your hand. You have two kidneys, one on each side, right and the left kidney, which is joined to the bladder by a tubular structure called as the ureter, and the urine which comes out of the kidney passes through the ureter and fills into the bladder. So each kidney is around 11 to 10 to 11 centimeters in length and about 5 to 6 centimeters in breadth. So it's a very small organ which performs a huge amount of function. So this is a pictorial representation of crudely how a kidney functions. So the blood flows through the kidney by means of a blood vessel, and once it enters the kidney, it is filtered there, and all the waste products and the excess fluid which is present there comes out through the ureter as urine, which gets collected in the bladder, and when the bladder becomes full, it is passed out as urine, and the purified blood is again returned back through the vein into the body. So some amazing facts about the kidney, not everything, I'll just try to cover 1 or 2 facts, is that every minute you can imagine about 1.2 liters of blood enters your kidney. That is 20% of what the heart puts out. And in a day, about 1,700 liters of blood is purified by the kidney. So in Kannada, there is a saying, Murti chikkadadru kirti doddu. So you can imagine an organ which is as small as your fist, filtering 1,700 liters of blood every day efficiently, 24 hours a day, without any rest. And an adult roughly has about 4.5 to 5 liters of blood in his body. And you can imagine that blood is purified 350 times every day by the kidney. So it's a very, very efficient organ, because of which we have to really take care of our kidneys. And other amazing fact about the kidney is a single kidney is enough for somebody to lead a normal life if it is working normally. So for any thing that happens to one of the kidneys, say injury or some tumor, if one kidney is removed, the other kidney is normally working, a person will lead a normal life. That is why you can always donate a kidney to a legally fit person whenever somebody needs kidney for transplantation, because one kidney can easily perform the work of two kidneys. So that is another very amazing fact about the kidney. So most of the general public think that kidney as a filtering organ. So it filters the blood and that's it. No, we are very wrong, because kidney has got enormous amount of other functions which helps you keep healthy. So first among them is removal of waste products, which is the function of the kidney. Apart from that, it balances fluid in your body. So it's very important. So for example, if you drink 1 liter of water now and you are adequately hydrated, in the next 4 hours, you will end up passing 80% or 90% of fluid that you have drunk already. So if the kidneys fail, this excess amount of water accumulates in your body. You end up having swelling of your legs, face, then finally fluids will start accumulating in your lung, and then you become breathless. So that is why many of them who have kidney failure appear puffed up and become breathless. So it's one of the very important functions of the kidney. And next, it helps in control of blood pressure. As you might have seen, if you have come across somebody who has got kidney disease, their BP is very, very difficult to control. It's really a very tough job to control their blood pressure. It also regulates hormones, which I am not going too deep, which is useful for leading a healthy life in a lot of other aspects also. And it keeps your bones healthy. So a lot of you, all of you know about vitamin D now because of the COVID season. I think every one of you would have ended up taking a dose of vitamin D capsule. So kidney is an important organ where activation of this vitamin D occurs. So whenever there is kidney failure, the vitamin D production in the body comes down, active vitamin D, leading to weak bones. That is the reason why patients who suffer from kidney disease can have fractures with just trivial injuries. So it is very important to maintain healthy bones. And it also balances all the minerals and electrolytes in your body, which is again very important for a person to survive. It also makes blood cells. Basically, it helps maintaining hemoglobin in our body. That is the reason why if somebody develops a kidney disease or kidney failure, their hemoglobin level drops and they end up becoming anemic. So this is few of the functions that kidney performs. So unlike what is thought of, it is just not a filtering organ. It is one of the vital organs in the body with lot of functions. So what happens when kidneys don't work well? Because it's got such a host of functions. When they don't work well, we are in really serious trouble. So, and it leads to serious problems of heart, blood vessels. So a lot of our patients who develop kidney disease, before they end up on dialysis, we end up losing them because of cardiac arrest or heart attack, because that is the amount of cardiac involvement that happens whenever somebody develops kidney disease. Finally, you will end up with severe kidney failure, and if not treated, of course, death. So the thing what I've written here as CKD is chronic kidney disease. So that is the important thing which occurs. And the scary thing about chronic kidney disease is that once somebody develops chronic kidney disease, it is not reversible, nor you can stop the progression of the disease. So finally, you'll end up in dialysis or transplant. So that is the reason why we emphasize so much on prevention. So about 5 to 10% of the population worldwide, including India, suffer from some sort of chronic kidney disease. And every year, millions of them die with want of treatment or dialysis or transplant because of chronic kidney disease. So that is the huge burden this chronic kidney disease carries. And as I told you, chronic kidney disease is currently not curable. Either you may develop chronic kidney disease because of diabetes, hypertension, or any other reason. Once a person develops chronic kidney disease, it is not curable and it is going to progress slowly, requiring dialysis or transplant at a later stage. Apart from this, whenever a person develops a kidney disease, indirectly the other organs are involved, especially the heart, and it will give rise to a lot of problem. And once somebody develops a chronic kidney disease, especially like in a developing country like India, where the GDP is quite low, most of these treatments are not affordable for a common man. So that is the reason why we emphasize so much on prevention. So this is a slide which shows that once you develop severe renal failure, what in medical terms we call it as end stage renal disease, your options are either you undergo dialysis, which is purification of the blood, which is done artificially using a machine, or you undergo kidney transplantation, right? And I put the amount there. So hemodialysis per month would cost anywhere around 12,000 to 14,000 depending on where you get dialyzed. Transplant would cost you around 4 to 6 lakhs, plus you will have to take medications every month around 10 to 15,000. So really the question is, how many of us Indians can really afford to spend so much money? Many of them won't have a salary of 12,000 for the whole family. So it is really scary that we cannot afford to have more kidney patients in our society. The other scary thing or the other important thing about kidney disease is hardly you have any signs or symptoms. Like if you have a cardiac problem or a heart problem, you'll end up having breathing problem while you climb the stairs. You may feel breathless, or you will have chest pain, because of which you'll consult a doctor. Whereas kidney disease early on, absolutely you don't get any signs or symptoms. Only when it is progressed a lot and when you have severe kidney failure do you start getting symptoms. And few of the symptoms are having a sick feeling in your stomach, nauseating feeling, you don't you stop eating, then your weight goes down, you feel fatigued and tired most of the time, your feet, hands and face may get swollen up. Sometimes if there is a kidney stone which is blocking, causing renal failure, you get backache. And many of them complain passing dark colored or foamy urine or frothy urine, and unexplained high blood pressure. Many of them go to the doctor, their blood pressure is not controlled. Definitely their kidneys should be checked. And also few of them may have decrease in the urination they do or the urine output, and some of them may have frequent urination. So these are the few symptoms that you might develop when you have kidney failure. But again, I'm telling you, most of these develop when you have got already advanced kidney failure. So early on, most of these are not detectable. So that is the importance of early checking. So now you know the burden of chronic kidney disease, how much burdensome it is. And once you develop chronic kidney disease, it is not curable. And I've told you already that not many symptoms are there early on. So you should know why you should get tested. Are you at risk of developing kidney disease? So these are the people who are at risk of developing kidney disease. So first, I have written diabetes because diabetes is one of the important causes. And about, if you take 100 patients with kidney diseases, about 30 to 35% of them have kidney disease because of diabetes, followed by its younger brother, hypertension, that is high blood pressure, which is the next common cause for kidney disease. Then you get other things like family history of kidney failure is there, or diabetes or high blood pressure. Then certain ethnicities, like if you compare an Indian or an Caucasian to an African American has got 3 times higher risk of developing kidney disease compared to other populations. So based on the ethnicity. And as you grow old, especially elderly, after 60 years, your chances of developing kidney disease is high. That is, you're prone to develop kidney disease because as you age. So on a general note, after 40 years, they say that roughly 10% of the kidney function goes down every decade as a natural process. So when you reach 60 years, about 16 to 18% of your kidney function would be down. And as you reach 70 years, it is still more down. So you are more prone to develop kidney disease. So if you have any of these risk factors or combination, say you're a diabetic, you have hypertension, you have somebody in family who has already developed kidney failure because of diabetes or hypertension, you are at more the risk to develop kidney disease. So if you have any of these or multiple risk factors, you should immediately always talk to your doctor and get your kidneys tested. So what do you test? So the only tests as of now are blood and urine tests to detect kidney failure. Urine, usually we test for leakage of any protein. That is the initial thing that happens where it is almost reversible. So you have to check for your urine protein, especially diabetics. And blood we check for chemical called as creatinine, and which is high indicates that your kidneys have already started failing. So if you don't do all these things, as I was telling, dialysis is the ultimate this one, or transplant. So this is how dialysis take place. This is called as hemodialysis, where you get hooked onto a machine and you'll be there for 4 to 5 hours, and your blood is filtered artificially using a machine, and it is sent back to your body. The blood which is filtered is again pushed back to your body. So this you have to undergo twice or thrice a day, and it is really not fun coming to the hospital once in 2 3 days and getting dialyzed, hooked onto a machine for 5 hours. So always it is good that you prevent from getting kidney disease and ending up like that. So what are the things you can do to prevent from you getting kidney disease? So definitely it is preventable, and lot can be done to prevent it. So these are the golden rules by which you can prevent kidney disease. I'll touch upon each one of them one by one. First is blood sugar. As I've already told you, blood sugar is the leading cause, diabetes is the leading cause for kidney disease. So if you have a strong history of diabetes, see that you maintain your ideal weight, keep yourself fit by regular exercise, and see that you postpone the development of diabetes, or you may altogether not get diabetes if you maintain a healthy diet and a healthy weight and exercise. So if you are a diabetic, always please do take care that your blood sugars are under perfect control so that your kidney is not affected. Second leading cause, as already reiterated, it is high blood pressure. So whenever you have blood pressure, please keep it under control. And you have any other risk factors like diabetes, make sure that your blood pressure is checked regularly, and see that whenever you develop hypertension, appropriate medications are taken and your BP is kept under control, which is very important. Next is diet and obesity. Follow a proper diet. All these fats nowadays, this keto diet, eating very high protein rich diet throughout the day is not good. You always balance your diet between carbohydrates, proteins, and fat, and do avoid obesity. Because, for example, say your ideal weight is 75 and you are 105 kgs, so you are 30 kgs overweight. So the kidneys, poor kidneys, will have to work extra for that extra 30 kgs. So they end up, over a period of time, there will be protein leakage and they end up starting having kidney disease, especially morbid obesity. We have seen a lot of them ending up with some or the other kidney disease. So maintain a proper diet and see that you don't become overweight. So next thing is maintaining healthy fluid intake. So healthy fluid intake, why I'm stressing is because two things I'd like to state here is healthy fluid intake is drinking adequate quantities of water in short intervals. I'm stressing there in short intervals because I know few people, especially elderly people, who tend to get up in the morning and drink 1 liter of water in a bolus, which is not correct. Especially elderly, you should not be drinking so much of water at a time because it can drop your sodium levels. So you have to drink maybe once in 3-4 hours a glass of water or some liquid to keep yourself adequately hydrated. Second important point that I'd like to stress here is I've seen people who exercise, go for a run or a brisk walk, come back, and if they're thirsty, I've seen them drinking this Coca-Cola or Thumbs Up, which is really a very bad habit because these contain very high sugar content, and what we call their osmolality is very high. It can damage the kidney instead of hydrating your body. So it's very important that you hydrate your body with water or fluid which is rich in electrolytes, and do not consume this highly carbonated and sugar content drinks. So it's very important that you don't do it. And it's also important that you don't take huge boluses of water. It should be in short intervals and adequate amount of water to hydrate yourself. Smoking, as you know, is bad for the heart and it is equally bad for the kidney. If you continue smoking, if you have, especially if you have kidney disease, your chances of ending up on dialysis is very high, and you will end up on dialysis or transplant in a very short period. That is, your kidney failure will progress very fast if you continue to smoke. So you have to stop smoking. One, to prevent kidney disease from occurring because it is a risk factor. Second thing is, if you have any sort of kidney disease, definitely you should stop smoking to reduce the progression of the disease. Exercise, everybody thinks exercise is good for the heart. Everybody goes for a jog, says that to tell that they're going for a jog, regularly exercising those, so their heart is fit. It's a wrong notion. Exercise is very important for every organ in the body. Same is true for kidney also. So exercise is important for your brain. It keeps you active. For kidney also, it is same thing. So regularly exercise and see that you maintain a good weight and good activity. And over-the-counter pills, what we call, which you can just go to a pharmacist and ask him and he'll give you. I'm sorry to say that in India, over-the-counter pill, you can get anything. From a painkiller to an antibiotic, you can go to a pharmacy shop and ask them. You'll get it very easily. Unlike in European countries or in US, where apart from paracetamol, I don't think you will get anything else from a pharmacist without doctor's prescription. I've seen patients for whom 10 tablets of painkillers would have been written for that time, and they would have continued to take it for years together, and then finally they end up with kidney failure, and then they come to us. So that should not be the case. Please take medications only with prescription of the doctor, and always take as much advice by him, and do not overextend the medications, because most of them would be over a period of time harmful to the kidney, including recently it has been proven that including the acidity medicine, what you take, what is called as pantoprazole, all these are quite risky to the kidney if you take it for a very long time. So the last important point for prevention of your kidneys, always get your kidneys checked regularly, especially if you have any of these risk factors, that is diabetes, hypertension, you are overweight, any family history of kidney disease, or you are from a high risk ethnic group. So if you have any risk factors that I've already mentioned, please go to your doctor voluntarily and ask him to check your kidneys. So get that blood test and urine test done and know your kidney numbers, which will go a long way in you people preventing yourself from developing kidney disease. So always love your kidneys. As a nephrologist, I always say that, end up telling people that instead of telling I love you from all my heart, please end up telling that I love you from both my kidneys, so that kidneys are always in your mind and you help in preventing any kidney disease. So please love your kidneys, and that is why if you love your kidneys and take care of themselves, you will not end up in dialysis. So you'll be prevented from ending up in dialysis. So always keep your kidney very happy and joyous, so that you live a good and healthy life. My mentor and guru, Padma Bhushan Dr. Mani, used to always tell us, don't feel proud at the end of the day telling that I have done 20,000 dialysis, I have done 1,000 renal transplant. You should not be proud of that. You should be proud of how many kidneys you have saved from developing kidney disease. That is your real contribution to the society. So I usually like to follow that. And if I have given enough knowledge to the people who are listening to this about kidney disease, and if I'm able to prevent at least few people from developing kidney disease by following the tips, my talk would be successful. Thank you all once again for listening.
Thank you, Dr. Manjunath Shetty. It was quite intriguing and insightful talk. No wonder you have active research collaborations with esteemed organizations like SERB and Renalix. And your research work, as I see, is quite helpful to the society. You took us through a ramp journey, starting from what is kidney to a feeling of what an organ is kidney. So amazing kidney functions and related nuances, which would make one's life more healthier by taking care of their kidneys. So now we are open for questions. As I see, there is one question on our chat box, which says, what is the percentage of renal failure when one has both hypertension and DM?
Yeah, see, as I told you, if you take 100 people, about 50 to 60% of patients who end up with kidney disease are from hypertension and kidney disease. So if somebody has diabetes and hypertension, it is not a rule that they should develop kidney disease. If you take care of your kidney very well, and if you control your diabetes and hypertension, you will have a very low chance of developing kidney disease. But if you don't, then your chances would be around 15 to 20% of developing kidney disease. So by telling kidney disease, my conclusion is not that you have kidney failure. Kidney failure is different, which occurs later. So persistent leakage of protein or some other things, what we call, also include in kidney disease. So kidney disease by itself doesn't mean that you have already have kidney failure. So this is the initial part where you develop kidney disease, then it goes on to kidney failure.
Another question, what is coming up to my mind when I heard your talk through is, you did say that the kidney symptoms are not quietly or are not easily detectable. So is there any thumb rule, or with your experience, do you think, is there any way in which a person can get a bit doubtful about his kidney and can go for a checkup, say maybe just a random checkup? Yeah, is there anything like that which you can help with?
No, as I told you, it's very true with kidney that early on, usually you don't have any symptoms at all. So that is the reason I enumerated all the risk factors. And if you have any of those risk factors, please go and get your kidney checked. And once you reach the third decade, previously they used to say once you reach the fourth decade or third decade, you should get yourself checked. Now, early on, we are seeing a lot of patients who are 24, 25 coming with cardiac problems. Then you see they have got already diabetes, hypertension, which is not detected. So once you reach that age, every year mandatorily you should check your sugar and BP. And if you develop any sort of that, then you have to go on to check your kidney every year. So if you're a diabetic or hypertensive, every year would be mandatory. Better if it is once in 6 months. So early on, most of the kidney diseases won't have any symptoms. We see a lot of them just walking into our chamber with a report which has been recently tested, and they really have advanced kidney failure. So that is the reason why I stress so much on prevention. Prevention aspect also involves yourself actively getting checked for your kidney health.
Right. And Doc, here is a very interesting question in our chat box. Some say that drinking beer is good for kidneys. Is it true?
No. That's a wrong concept. A lot of them think that you drink beer and your stone or small stone, whatever gets passed off. That's just more fluid you're taking. That's all. So beer drinking is not good for the kidney. Actually, excess beer drinking can cause some what we call electrolyte disturbance, and also it's not really, definitely not good for the kidney.
Right. So probably our yeah. And another question is what is normal intake of protein, which is probably good for kidneys, or which kidneys can manage?
See, normally we say you can take about 1 gram, 1.2 gram protein per kg per day. So you cannot literally check into everything. You pick up something and you cannot literally Google it and see how much protein is there or how much this one is there. So you should balance your diet in such a way that you don't take only meat. The keto diet in the last decade had become a fad, which is the biggest failure of 2020. Keto diet involves taking only high protein food throughout the day, which is really bad for the kidney. You end up exposing the kidney to very high protein, which it has to filter, and at that bargain, your kidney gets damaged. And a lot of papers have been already published that you should not go for a very very high protein diet. So balance your protein, maybe is about 40% carbohydrate, and then maybe 30-40% protein and 10% like that. So carbohydrate is absolutely not bad. It is required for our body, but everything should be taken in a proportion. So as I said, technically you would recommend 1 to 1.2 gram of protein per kg per day. And here I'd like to say a word of caution is that in keto diet, the major harm is caused by the animal protein that is taken. Vegetable proteins usually don't cause much harm. In fact, we don't even stop vegetable proteins in patients who already have kidney failure. So we ask them to continue vegetable protein. Only thing we restrict is animal protein. And the other thing everybody should remember is milk is also animal protein. So it's an animal product. So pure vegans don't even take milk. Milk is also an animal product. So keep everything in balance.
Right. Probably it answers our next question, which says, what will be a good diet to maintain kidneys in good condition? So if you have anything to add on to what you have already said, you
No,
can
I
probably.
always tell eat what your forefathers used to eat, and then be healthy rather than going in for all these fat diets or all this GM diet where you go on a rapid fasting. Rapid weight loss is also not good for the body. So always maintain a healthy proportion and see that you eat less fat, less sugar content in the food, and carbohydrates maybe around 50%, and then 30-40% of proteins and 10% of fat, something like that. Basically, it becomes a tedious process for you to keep measuring everything and eating. So it's not possible in your day-to-day life. So avoid junk food, eat healthy food like vegetables, salads more, and then little less of carbohydrate. Mix and match everything and eat.
Right. So while we wait for a couple more questions, we have 5 to 10 minutes more, which we can use. I was wondering if a kidney failure patient, say for example, undergoing dialysis, and is there any measure which can say that okay, this much portion or percentage of kidney is not functioning or has gone bad, and can be recovered, cannot be recovered? Is there any measure as such? And
A person who is undergoing dialysis, that means his kidneys have totally shut off. So we usually start dialysis when their kidney function comes down below 10 to 8%. So that is roughly when we start somebody on dialysis or somebody has to undergo transplant. And definitely there is number, as I already told you, you have to check your blood for creatinine. Using that creatinine, we calculate something called as a estimated GFR. That gives the percentage of working of your kidney, and as the creatinine increases, the percentage of work in the functioning kidney comes down. So that roughly in general public term, we call it as kidney numbers to make them more accustomed to these terms. So we can tell the percentage of kidney that is working.
okay, yeah, actually there is another question which says what is kidney number, which you mentioned
Yeah,
probably in your
that's what we
presentation
call
as
it as kidney number. In medical
right.
terms, it is estimated GFR, that is the filtration capacity of the kidney. We calculate it using your age and the creatinine number and your ethnicity and whether you are male or female. So a lot of things are there. You just feed it to the computer, it will give out a number that we call it as kidney number. Roughly, it is the percentage. So if it gives us 30, that means your kidney is hardly working with 30%, 25 to 30%. So that's what is called as kidney number.
There is another question which says, please throw some light on kidney donation.
Okay, good. Actually, I wanted to put slides, but my talk was only kidney and your health. Actually, my wife also suggested you talk something about donation, but time was a constraint. Kidney donation are of two types. One is live related donor, where husband donates to a wife or the parents donate to children. So where you are matched, and then if your blood group is matching, and then no other problems, a person should not be a diabetic or hypertensive to donate. Then we evaluate everything, and then a surgery is done where you operate and take out the kidney from the donor and put it in the recipient. The next type of donation is called as cadaver donation, or a person who is brain dead donates the kidney, which is one of the very favorite things for me, because each year millions of people are dying because of want of organs. At present, if you take in India itself, around 5 lakh people are waiting for some sort of organs to get transplanted, especially with COVID coming in. Lung transplant is gone up so much, the demand for lungs is gone up so much. This is where a cadaver transplant helps. Say unfortunately any of your near ones or dear ones end up with some sort of road traffic accident, suffer severe head injury, and brain death occurs, where the brain is completely stopped working, and you will not come out of coma, but your heart is functioning, there is heartbeat, BP is maintained, but you are dependent on ventilator for breathing. Then with all the parameters, so many parameters are there where doctors team will decide whether a person is brain dead or not. Once he is pronounced brain dead, if the family agrees, then we can harvest the organ. So each person, if he donates in such a state, can save almost 7 to 8 lives. So lungs, heart, two kidneys, two eyes, and intestine. So many things can be harvested. So, but once a person is completely dead, means his heart has stopped working, that is called as complete death. Only the cornea, that is the eyes, they can be harvested, whereas kidney, heart, and liver, all these things cannot be harvested. So this harvesting of all these organs can be done in a brain dead person, which the young Indians and a lot of other people are trying to promote. And in a good way, it is picking up in Karnataka, and our neighboring state Tamil Nadu is pioneer in that.
Right. Doctor, there is another interesting question which says, does gender affect the kidney number?
Females usually tend to have a lesser GFR, what I told, kidney number, because the female body, the fat is slightly more compared to males, and then the muscle is little less compared to males, right? So because of which the muscle produces creatinine, their kidney number slightly tends to be on the lower side, but it does not, in no way it will affect your regular normal this one. So that is the way physiology is. And male and female muscular person especially will have a little bit more GFR compared to a non-muscular person, and it is not going to affect you in any way throughout the life. So it is same risk factors applied to male and females. Nothing that the females will develop kidney disease earlier compared to males. No difference in that way.
Right. I believe we are pretty much at the end of our session. So it was quite interesting. There is one question which is asking about symptoms. As it's already been discussed, I believe the symptoms are not that easily
Few of the
identifiable.
early symptoms that you get is swelling of the legs. So if you are a diabetic and you develop hypertension or you start developing swelling of your legs, definitely you should consult your doctor and ask him to check up your kidneys. And some people do develop decreased urine output sometimes, but most of the times early on, till kidney function comes down below 50-40%, not many symptoms will be there. That is the reason I was again and again stressing as to how to prevent your kidneys and regularly get them checked.
Right. So I feel people have caught up on the idea of love your kidneys or save
Definitely.
love kidneys. So
So I'll
another
be
question we
happy.
have is, for a healthy man, what is the ideal kidney number?
Ideal kidney number depends from a person to person. It depends on your height, your body framework, and your weight. So we call it, what the number we are telling is EGFR should be above 80, right? So if your creatinine, what you test is normal, do not go to check your kidney number because it comes a little skewed. Only if the creatinine, what we test is high, then you have to go on to check your kidney number. Otherwise, if your creatinine, what we test in the blood is normal, do not go to check your kidney number. So a healthy kidney number should be above 80 in a normal person. But if you are well built, say 6'2", weighing about 100 kgs, then your kidney number will be higher compared to a person who is 5 feet, weighing about 50-60 kgs, right?
Right. Thank you, doctor. That pretty much covers all our questions currently in the chat box. Probably you can contact us through the same YouTube video in case there are any questions left which are unanswered in this talk. They will probably be answered by Dr. Manjunath Shetty when he visits the web YouTube link, and he can just chat. He can write an answer to that chat itself. So
Sure.
thank you very much, Dr.
Thank
Shetty,
you. It's
and
my
it
pleasure.
was
Yeah.
a wonderful talk. And the takeaway of this talk would be, kidney is an vital organ. Love your kidneys and your loved ones' kidneys along with the hearts.
Yeah,
And
love your
golden rule.
wife's kidney also. You have to take care of
Yes, very much.
everyone's
That's
kidney.
what I
So
was
you can love
mentioning
others'
now.
kidney also.
Yes, golden rules for keeping kidneys healthy. I feel it has made our wellness event tagline, in aid of poor renal failure patients, well supplemented. Thank you for your time and wonderful talk.
Thank you. It's my pleasure. I'd like to thank all the donors who have supported our Kidney Endowment Fund and enabled us to help a lot of poor and needy patients to undergo dialysis, in that way saving their life and making their family also happy. Thank you.
Yes, absolutely. Thank you. Thank you all. Thank you all for viewing the video. We go off live from here. Thank you.
Thank you.